All right, sorry for the delay. Can you hear me now? Can you hear me, please? Majority of passive immunity, majority, it lasts for weeks to months. It lasts for weeks to months. Okay, I'm trying to read people's question. Okay. Okay, someone say explain on artificial. Sorry, let me. The non-cellular defense. They are in the slides now. I've listed them. They are on your slide. The non-cellular defense. Someone said talk more about. I'm coming. No, innate immunity is not divided into active and passive. I never said anything like that. Even from the diagram, you can see it. I never said anything like that. Adaptive immunity. That was what I said. That was why I used this diagram so that we can get it clearly, so that we will not be confused. So this diagram will make you to understand clearly. If we have active and passive, I will have put it there. So you can actually see that under adaptive immunity. Okay, let me just go through the diagram because I can't find the person's question again. Like I said earlier, I said immunity is divided into adaptive and innate. From the word innate, innate means it is natural, inborn, while adaptive is something that you acquired. You were not born with it. So adaptive is divided into natural and artificial. It is divided into two, natural and artificial. Natural too can be passive, it can be active. Artificial can be passive and it can be active. So it is either these two ways, it's either passive or active. If it is natural, if it is naturally adaptive, passive one, that I've cited an example in the diagram, I mean, in the bracket that, take for instance, maternal. When a child or a fetus gets an immunity from the mother, that is passive. Although it is natural, it is acquired, it is natural, but it is passive. It wasn't that child that developed the immunity by him or herself. The child got the immunity from the mother. So that is why it is passive. Something that you did not develop yourself is passive. But if you have an infection, that was why I used chickenpox. If you have an infection and then you developed antibody during that period, that is active. I don't know if I get what I'm saying. That is active. It is natural and it is active. Now for artificial. Artificial, we have passive and we have active. Artificial was given to you, like antibody transfer and through immunization. Those are the two ways where you can refer to, oh, okay, this immunity is artificial. When you have antibody transfer and you have immunization, when you take immunization for all these our normal immunization, that is artificial and it is active. Please, is the person clear now? Are we clear? The person that asked the question, are you clear now? Sorry, can we continue, please? Can we move on? Mentioning acquired. Sorry, I'm trying to read people's question, but I don't know. Yes, my antibody, like when you give injection of antibodies such as gamma globulin, that are not produced by recipients. That's what I mean by antibody transfer. All right, thank you. Let's continue, please. Let's go to study section 12. Can we move on? Can we move on, please? All right, thank you. So for study section 12, we are talking about hypersensitivity reaction. So what do we mean by hypersensitivity reaction? What do we mean by hypersensitivity reaction? I want to try and then. Thank you. Let's continue. Sorry. So hypersensitivity reaction refers to a state in which the body system has an increased tendency to react in an abnormal manner when encountering a specific antigen. This can lead to a range of tissue responses spanning from serum sickness to allergic responses like hay fever, and in most severe cases, even to anaphylaxis. Most of the time, we say anaphylactic reaction, anaphylactic reaction, anaphylactic reaction. Take, for instance, now, if a patient comes into your ward or comes to the GOPD and they tells you that, okay, the person has sustained, they had insect bite or scorpion or bees. So you can see that immediately there will be some like hypersensitivity reaction, anaphylactic reaction. You begin to see the patient will experience a lot of there will be swelling, you know. The patient, even if you are not careful before you know it, the patient can go into respiratory distress. So it is a very quick reaction to antibody, to antigen, to a specific antigen in our body. So we have types of this hypersensitivity reaction. We have type 1, we have type 2, type 3, and type 4. You have to know their name. Very, very important. Type 1 is known as the immediate or anaphylactic reaction. Immediate or anaphylactic reaction, that is type 1. The one you sustain immediately when you have all these insect bites. Or when you have what's it called, maybe food reaction. You know, there are some people that react to food before you know, it's very within a short period of time, they will start manifesting all the signs and symptoms. Then we have type 2, which is cytotoxic hypersensitivity. We have the type 3, which is also known as immune complex hypersensitivity. We have type 4, which is cell-mediated or delayed hypersensitivity. Now let's start with type 1. Now type 1 hypersensitivity is an exaggerated and rapid. It is very rapid, very short, within a short period of time. When a patient is experiencing this type of reaction, you will see them showing the signs and symptoms within a very short period of time. And that is why, as most, you have to be proactive. You start looking for, okay, give adrenaline, give corticosteroid to these patients. So you have to be very proactive when it comes to this type 1, because it is very rapid. It is exaggerated. Now, this immune response, this immune reaction involves release of histamine and other inflammatory substances from mast cells and basophils, leading to allergic symptoms. Examples include hay fever, allergic asthma, anaphylaxis, and skin reactions. Then immunoglobulin antibodies are produced in response to allergens, and repeated exposures can intensify allergic response. Management involves avoiding triggers, using medications like antihistamines, in severe cases, employ emergency treatments like epinephrine. So one thing you have to know about type 1 is that it is exaggerated. It is rapid. Within a short period of time, the patient is going to react. And you have to be proactive. You have to give medications to actually make sure that, okay, this patient does not go into anaphylactic shock. Now let's go to type 2. Type 2 is also known as cytotoxic hypersensitivity. In type 2, there is an immune response where antibodies mistakenly attack cells or tissues with specific antigens. So in this type 2, that's where we see a lot of autoimmune disorders, whereby the body, the cells, they are attacking themselves. So it can lead to cell destruction, autoimmune disorders like all these hemolytic anemia, thrombocytopenia, myasthenia gravis. You know, all these disease conditions that I'm mentioning, they are more like autoimmune. When we say autoimmune, that means the body is fighting itself. The body is destroying itself. And it can also be seen in grave disease. So antibodies trigger processes like phagocytosis and complement activation. Diagnosis tests like home tests helps to identify this particular reaction. So treatment involves immunosuppressive medications and treatments tailored to specific immunosuppressive. Example of immunosuppressive medication is corticosteroids that you can give to them. Now, type 3. In type 3, there is an immune response where excessive immune complexes form in the bloodstream. So in type 3, the immune complex, they form in the bloodstream and deposit in tissues, thereby triggering inflammation and potential damage. It can also lead to autoimmune disease too, like all this systemic lupus erythematosus and rheumatoid arthritis. We know that rheumatoid arthritis is also an autoimmune reaction. It is an autoimmune disease. So we have localized reactions and systemic reactions. So when we talk about all these things, there will be systemic reaction, there will be autoimmune reactions. So diagnosis tests visualize immune complex deposition, and treatment involves managing inflammation through immunosuppressive medication. The beautiful thing about all these hypersensitivity reaction is that you can actually manage them with almost the same type of medications, but the way they form is different. Their mode of, their pathophysiology is actually different. Type 1 and type 2, type 3, they are not the same thing. Now type 4, which is known as cell-mediated or delayed hypersensitivity. In type 4, there is a delayed immune response involving T cells that react to antigen. Unlike other types, this doesn't involve antibodies. So it leads to inflammation, typically appearing between 24 to 48 hours after exposure. Conditions include contact dermatitis, tuberculin skin test, and autoimmune disease. So T cells release cytokines, they attract immune cells and cause tissue damage. So granulomas can form in some cases. So in this condition, part testing diagnosis contact dermatitis. You know, this contact dermatitis is okay, maybe a patient sometimes when you go on holiday, or maybe you go out for like a field work and you come in contact with all these plants, and before you know it, when it touches your skin, you know, they release all their poison ivy on your skin, and before you know it, you start reacting. That's contact dermatitis. So sometimes immunosuppressive drugs are also good for them. So management involves identifying triggers, using treatments, and sometimes immunosuppressive drugs. Any questions so far, please? Okay, so please make sure that you know the different types of hypersensitivity reaction that we have, and know the difference between the four of them. Know the difference between the four of them. Know their different names. They have different names. We have type 1. Don't just say, okay, we have type 1, we have type 2, type 3. No, know their name. Very, very important. Know the name and know what happens in each of these hypersensitivity reaction. Yes, in type 2, I told you that in type 2, it's more like an autoimmune. I don't know how to explain better, but in type 2, I told you that the cells are attacking themselves. So the cells are attacking themselves. It is an autoimmune disorder. So immune response where antibody mistakenly attack cells or tissue with specific antigen. It can lead to cell destruction. But in type 3, more like there is an excessive immune complex that is deposited, that will form in the bloodstream and deposit in tissue. Although it can also lead to autoimmune disease. I'm not disputing that fact, but that is the main difference between the two of them. In type 3, there is excessive deposition of immune complexes in the bloodstream. So it is that immune complex that will trigger inflammation and potential damage. Questions, please. Someone is talking about neonatal jaundice. We have two types of jaundice. Which one are you talking about? I don't understand your question. Yeah, I'm going to upload the slides. I'm going to upload the slides. So you have no problem. I'm going to upload the slides. Yes, type 3 too can lead to autoimmune disorder, but the way they happen is different. It is different. One, there is attack, the cells are attacking themselves. The other one, there is deposition of immune complex. Those are two different things. Someone is asking about type 4. Okay. In type 4, there is a delayed response. There is a delayed response. That's the major thing that is happening in type 4. Now, summary. Hypersensitivity reaction is a condition whereby the body's immune system is prone to respond abnormally to the presence of a particular antigen, which may cause a variety of tissue reactions, ranging from serious sickness to an allergy, such as hay fever, or at severest to anaphylaxis. And hypersensitivity reaction can be divided into four types: type 1, type 2, type 3, type 4, based on mechanism involved and the time taken for their reaction. Like I said, type 1, I told you that it is very rapid, it is exaggerated. Like here, I said it is immediate. Anaphylactic response, I mean, hypersensitivity. And at one point or the other, as nurses, we have managed patients with what? With anaphylactic reaction, patient that comes in with asthma, patient that comes in with insect bites. You know, the way they rush in, you have to be very proactive, give them epinephrine, give them corticosteroid, because the the reaction is very rapid. If you are not very careful, you can lose your patient with this anaphylactic reaction. So that is type 1. It is immediate, it is exaggerated, and it is very rapid. That's majorly about type 1. I'm sure we all understand. Type 2 hypersensitivity, also known as cytotoxic hypersensitivity, may affect a variety of organs and tissues. Type 3, also known as immune complex hypersensitivity, the reaction may be general or may involve individual organs. Then type 4 hypersensitivity is also known as cell-mediated or delayed. I told you, please go and know the name of each of these type. Go and know the name. So the classical example of this hypersensitivity is tuberculin reaction, which peaks in 48 hours after injection. You know, when the patient has been exposed to tuberculin, you want to do all this clean tuberculin. So, you know, you inject it, when immediately after giving them the injection, you tell them to go and come back within 48 hours so that you can actually see the reaction. So this is an example of type 4 hypersensitivity reaction. Any question before we call it a day? As regards the, sorry, I think like for 2 classes now, I always forget to record. So what I'm going to do is that I'm going to upload the slides, and the few, I think it's only one study section. Okay, the first, I think maybe study section 3 and this. I'll try and record. I'll try and do a short recording and then post on LMS. So I'm very sorry about that. So this study section 12 has been recorded, so I'm going to post it on LMS. So please, if there's anybody that is unable to join, or maybe you are no chance, I don't know, if you are no chance to join, or maybe peradventure you miss the lecture, you will have access to it on LMS for sure. So I'm going to upload all these slides, you are going to have it on the LMS. So I'm going to put them on the LMS. Then I'm going to upload the lecture. Then the one I missed, I will do a short recording just to explain the key points that is needed, and then I'll upload soon. So I'm sorry about that, please. Sorry. Let me try and read people's questions. Attender, I don't know about it all. We have told you that class is 2 p.m. So why are they not here? I don't know why are they not here. Let me try and read people's questions. So please, I will upload another quiz. Make sure you do your quiz. Don't joke with any of the quiz. Don't joke with them. Take them very serious. Take them very serious. Take your quiz very serious. Because I don't like situation when students will be begging and please, ma, I forgot to, I didn't do my quiz. No, 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 I don't like that. Do your quiz. And if you do your quiz, it will actually help you, because most of the questions in the quiz will also come out in your exam. So if you do your quiz, you are actually helping yourself, because once you have come across a particular question before, once you see it in your exam, you will know the answer straight. That is it. You will know it, because they will be part of your exam questions, CPT questions. So when you do your quiz, you are helping yourself. So even if you don't score well in the exam, by the time you attempt quiz, you do your assignments, your attendance, everything is added together. You know, you only need to do little for you. I'm not discouraged. I'm not saying you should be lazy now. Don't read for exam. So, but this is part of a sacrifice. You have to do your quiz. Make sure you do it. It's part of the thing you have to sacrifice. I know there are a lot of work to be done. You have several quizzes to do, but you just have to create time and do it. Because by the time you start begging me, I will not listen. So thank you for your time. Thank you for your time. What of a patient that reacts to okay, someone there, sorry, that react to a particular drug? Okay, I don't understand that question. As in, what type of reaction is that? Is that what the person is trying to say? It's also an allergic reaction. Yes, we will classify it under type 1. Can classify it under type 1. I've not ended the card because I'm trying to read people's message, and then I've explained on artificial passive immunity. I'm not going to do that. Please try and read the diagram. I'm not going to do that again, please. You know, normally some patients, when they come to the clinic, you ask them, oh, well, don't you take this particular medication? Do you have any reaction to this particular? You know, when you are taking your patient's history, you know, you ask them that, okay, do you react to this particular type of medication? So I believe we should classify that under hypersensitivity, I mean, under type 1. When a patient is reacting to a medication and you give it to them, you can see that the reaction will be very rapid. And we said that type 1 is what? There is exaggerated response. Look at the case of all these chloroquine, all this quinine. When a patient is reacting to it, if you put your patient on quinine and the patient is reacting, they will start having tinnitus now. If you put your patient, if you give chloroquine, although I don't think people use chloroquine again, they will start telling you that, oh, they are having a itch. I mean, their body will be itching them. So that's an example of a type 1, personally for me, because the reaction is immediate. It is immediate. When a patient is reacting to medication and you give it to them, it is immediate, it is rapid. So it's a type 1, it's under type 1. Okay, increasing the capacity. Well, that I think that's one, you should relate that to the school. Omitted sections. There's no problem with omitted section. I told you that the second lecturer is going to take everything. The second lecturer is the one taking the omitted section. So he's actually going to attend to you. I believe he's busy. That's why he has not attended. So I'm taking the study sections that has been allocated to me. So you don't have problem. He's going to attend to you when so far it's chance. Once it's chance, he's going to attend to you. So we are not going to miss any section. Blood transfusion reaction, it can be delayed. Blood transfusion can fall under type 4. It can fall under type 1. You know, we have different type of blood transfusion reaction. We have the hemolytic reaction. We have the febrile. So blood transfusion, it can be, and we have delayed. There are some blood transfusion that after so many years or after many months, that's when the patient will start reacting to it. So it can fall under type 1, it can fall under type 4 for blood transfusion reaction. So thank you for your time. So have a lovely day. Bye. Do your quiz. Oh, okay.